Hi everybody. It was come to my attention through Becky that you thought maybe it might be a good idea to do to continue the bones where we left off last week, and then get into the muscles this week. So I'm going to screencast a few slides here, a couple of slide sets that relate to the bones, with the hopes that what we'll do in class this week is actually get into the muscles, which I don't think is worthy of a screencast because it gets a little bit complicated, and I think it's better off that the muscles get done in class. So, as we took last week, if you remember, we talked about we've talked quite a bit about the distal humerus, and to some degree in regards to the radius and the ulna. So I want to go a little bit deeper into this radius and ulna in terms of their structure and what we find on them. And as you know, I've already talked quite a bit here about the radial notch and the coronoid process and so forth, and the trochlear notch. So we're just going to get into it a little bit deeper, and then of course we're going to go off to the distal parts of the two bones as well. So again, remember that the forearm is actually termed the antebrachium, whereas the upper arm is considered the brachium. And as we now know, there are two bones that are related to the forearm, and that is the ulna, which is on the medial aspect of the forearm in the anatomical position, and the ulna, which is the radius, the ulna, which is on the medial aspect, and of course the radius that is on the lateral aspect in the anatomical position. They generally, in the anatomical position, are parallel to each other, of course. And when we talked a bit about this last week, when the forearm is pronated, the radius crosses over or lays over, or in the anatomical position, the distal radius lies anterior to the ulna. Now, we talked a little bit about this last semester, about this interosseous membrane. This is just a reminder that between the two bones there is a space when you lay them out anatomically, and to help with muscle attachments and so forth, there is an interosseous membrane that lies between the two bones. Each bone has a head, with the head of the radius being proximal, whereas the head of the ulna is distal. So something you may want to sort of highlight to remind yourself. The head of the radius is proximal, and the head of the ulna is distal. So the radius, as I said, it's the lateral aspect of the forearm in the anatomical position. So I always remember it as radius thumb, because again, it's on the lateral aspect. It is shorter than the ulna in comparison. The proximal part of the radius is, as I said, is the head, and it is a short cylindrical head, and it is disc-shaped, and if we remember, it articulates with the capitulum. So we can see here we've got the head. You can see it is somewhat concave in nature, so that it can articulate appropriately with the convexity of the capitulum of the distal humerus. The neck lies just distal to the head, and it is a narrowing that's just distal to the head. And we call it the neck because it is narrower, and you can see it here just underneath, or just distal to the radial head. We can see that the neck narrows in right in underneath it, remembering that we've got this concavity of this head that articulates with the capitulum. The neck, as I said, is narrow compared to the head, and on the medial side of the neck is where we find this tuberosity of the radius, which of course we talked about last week, because the tuberosity of the radius is the distal attachment for biceps brachii that we can see right here. We can see it quite well here as well. And in the drawing here, you can see they've colorized it with the head being in yellow, the neck being in blue, and the radial tuberosity being in red. And again, this is the attachment for biceps brachii. The body, or diaphysis, or the shaft, if we go from proximal to distal, it does increase in width. In other words, it gets larger as it travels distally. It is convex laterally for the proximal 3/4, and then flattens out for the last quarter. So we can see that there is a convexity laterally here. So to give us a sort of a place where we are here, we can see that we've got, again, the proximal aspect here with the head, the neck, and the radial tuberosity. And this represents the lateral aspect here. You can see there is a slight convexity to it. Anteriorly, there is a line that is continuous with the radial tuberosity, and this is known as the anterior oblique line. So running down below across from it. So I don't know if I have it here on the diagram or not, but it is an oblique line that is a continuation of the tuberosity of the radius. The medial part of the shaft has a very sharp ridge on it where we find the attachment for the interosseous membrane. So we're going to have to realize that the lateral aspect of the interosseous membrane finds attachment on the medial aspect of the radius, okay, which we find this sharp ridge. When we compare the medial surface to the lateral surface, the medial surface is much sharper because of this interosseous membrane attachment, and we have a much rounder, smoother, convex lateral aspect that smoothness to the lateral aspect of the radius. Now, as we travel distally, we said that the radius gets larger, and it does, and as it moves laterally, it starts to get very large and has very distinct features to it. The first is found on the medial aspect. So on the distal medial aspect of the radius, we have a notch that finds articulation, or a notch that articulates with the ulna. So when we have the two together, we can see here that we have something that's going to occur between the head and the lateral aspect of the ulna. And this will be the other set of slides today. This is the proximal radial ulnar articulation, but there's also a notch on the distal medial aspect, again in the anatomical position. So the distal medial aspect, there's a notch which is concave in nature, which accepts the convexity of the head of the ulna. And we can see it here in this diagram. We're looking at the medial aspect of the radius. We have our head, our neck, our radial tuberosity. Here's the oblique line that we can see here. And then we have this sharp ridge here, which is the attachment for the interosseous membrane. And again, on the medial aspect, we can see this fairly large notch here, and this accepts the head or the distal part of the ulna. So we say on the medial aspect of the distal radius is the notch for the ulnar articulation called the ulnar notch. On the lateral aspect of the distal radius, we find a process that sticks out, and this is known as the radial styloid process. And if you palpate yourself at the distal radius, you'll find a very sharp process, and that represents the radial styloid process, which we see right here at the very end. So again, here's our lateral surface of the radius. Again, medially here we see the ulnar notch. Laterally out here we have this sharp process at the very end on the lateral aspect, and this is known as the styloid process. On the dorsal or posterior surface is something called the dorsal tubercle. This tubercle lies between the groove for the tendons of the forearm muscles. This will play a bit of a role when we're discussing the tendons of forearm muscles as this separates. But this also has a name. It's known as Lister's tubercle. And if you put your hand in a pronated position and feel, you've pronated, so now the lateral aspect of the radius has become medial, sort of run a straight line down from your third finger, your long finger, run a straight line down from your long finger, and you'll come right on a sharp process there. And this is known as the dorsal tubercle. It deliberately separates tendons, which we'll learn when we get to the muscles. Okay, and you can see the dorsal tubercle right here. Okay. The ulna is the longer of the two forearm bones. It's also the medial of the two forearm bones, and we've already taken a good look at this when we were looking at the elbow joint and the distal humerus. And as I've said before, it looks a bit like a pipe wrench. And this, of course, is the stabilizing bone of the forearm. Because of the way that the proximal ulna and the distal humerus articulate, it is an extremely congruent joint, very strong. And as we know from the elbow joint, it only allows for flexion and extension, so it stabilizes the forearm. The proximal end is larger as compared to the distal end, which, and I have in brackets here to remember, it's opposite as compared to the radius. So we'll remember the head of the radius is proximal and the head of the ulna is distal. So we can see here we've got this pipe wrench configuration here proximally, and we can see the head is distal down here. Whereas if we go back to the radius, the head is proximal with the larger area distal, and then the ulna, the larger area here is proximal with the head distal. So we know that there are two prominent projections in the ulna. The first is called the olecranon, which is its posterior projection. We kind of know it as the elbow. The other part is the anterior process, and this is known as the coronoid process. So if we see here, here is our olecranon here from the posterior view, and here is our coronoid process here anteriorly, and a little bit coming out medially as well. So again, we see here, here's our coronoid, our olecranon here in green, and our coronoid process here in red. The anterior surface of the olecranon forms what's called the trochlear notch, which again we've talked about last week. And this trochlear notch articulates with the trochlea of the humerus. So of course its name helps you remember what it articulates with. The trochlear notch articulates with the trochlea of the humerus, and as we know, this is the true elbow joint. If we divide the trochlear notch out a bit, the coronoid process is in fact actually the floor of the trochlear notch. So we can see here it's the trochlear notch here to articulate with the trochlea, and we can see here that we've got the coronoid process that represents the floor of the trochlear notch. On the lateral side of the coronoid process is the radial notch for the head of the radius. So remember we talked about back here when we looked at the articulation between the radius laterally here, we can see here, and the ulna medially, we said that, you know, that the neck is round in nature, and that there would be a notch both proximally, the notch was distally, the notch was on the ulna to articulate with the head of the radius. So the notch is on the head of the radius to articulate with the notch of the ulna, whereas the head of the radius finds the notch in the proximal ulna for an articulation here. So here we go. Here we're saying that on the lateral side of the coronoid process, right, which is here, we have a notch called the radial notch for the head of the radius. So do you remember when we talked about the ligament that surrounds the head of the radius? It is that ligament in the elbow, that ligament that surrounds the head of the radius. It holds the head of the radius in the radial notch of the ulna. That's what's happening with it. Now, inferior to the coronoid process, we find the tuberosity of the ulna, which is the distal attachment for brachialis. So remember, we had the radial tuberosity here in the radius for articulation of biceps brachii. And then here we've got the, I don't see if I have a picture of it here, the coronoid process, right? So we can see here the tuberosity on the inferior part. I don't think I have a good process here, but that would be this kind of right here would be the place where brachialis finds its distal attachment. So inferior to the coronoid process, right here, we see here is the ulnar notch, or the ulnar tuberosity, right? The ulnar tuberosity, which is the distal attachment for brachialis. As we said, the proximal ulna looks like a wrench. and this configuration of a wrench with the trochlear notch, then we can now say that this wrench grasps the trochlea of the humerus. Inferior to the radial notch is a prominent ridge. This is known as the supinator crest, which is the attachment point for a muscle that we learned last week, which is the supinator muscle. Okay, so we're saying here, inferior to the radial notch, okay, which is here in blue, you can see a line right here, which is the attachment for supinator. The body, now where the medial surface of the radius was sharp for the attachment of the interosseous membrane, as compared to the radius, the ulna, it too has a lateral edge for the interosseous membrane, but it lies on its lateral portion. So the medial portion of the radius is for the attachment of the interosseous membrane, and the lateral edge of the ulna is also for the attachment of the interosseous membrane. Where the radius got larger as it traveled distally, the ulna actually gets smaller as it travels distally. So when we look at the distal ulna, it has a rounded head. It also forms within this head, it forms on the medial aspect a conical shape called the styloid process. And again, if you take your hand and pronate it, so now in the pronated position, you're looking at the lateral aspect of your arm of your forearm, distal forearm in the pronated position. That big bump that you notice always at the wrist, that represents, that bump, the styloid process of the ulna. And of course, because we have this area of articulation distally between the radius and ulna, there is a concave area on the lateral surface of the ulnar notch of the radius. In terms of it, so well, just a moment here. Hang on, just a moment here. Sorry, I just had to check myself there. There is a convex area on the lateral surface for the ulnar notch of the radius. So if we go, here again, and we have a look, right? Remember, we had a notch on the radius, on the distal radius for the head of the distal ulna. The distal ulna, of course, has this convexity that will fit into the concavity of the radial head. So we can see here is your styloid process here, which we just palpated. Here is the head with the convexity that will fit over here in the radius into this ulnar notch for our distal ulnar radial articulation. So again, we've got a proximal head in the radius that fits into the radial notch here of the proximal ulna. And then our distal radius, it has a concavity as well, the ulnar notch, which takes the convexity of the distal ulnar head that we can see here. So we have a proximal radial ulnar joint, and we have a distal radial ulnar joint. That's it for the forearm bones. We're going to continue on here. There'll be another set. Thanks for listening, and I will continue.